welcome back to the Miraculous Mamas podcast. I'm your host, Elizabeth Joy, and we believe in empowering women through storytelling and education. And today we have a bonus episode for you guys. We wanted to do an update on COVID-19, what it looks like in labor and delivery. I know every single hospital and state is different, but we brought on Emily Scott, who's going to go over the updates with us and help us stay informed on even what your rights are during labor and delivery. You always have to find out your hospital policy, but beyond that, you still have rights there. So it's just a nice podcast to get up to date on all of that information. Before I dive in, make sure that you guys go to ritual.com/mamas to check out the prenatal vitamins that I am taking. They also have just women's health vitamins. They're an amazing company with super clean products, and you guys can get 10% off during your first 3 months at ritual.com/mamas. Also, I reached out to my friends at NutriVerb because I am going to be talking about sperm health a little bit on the next few episodes as we have men on sharing their stories with us. But sperm health is so important in the fertility journey, and we put so much of the weight on ourselves as women. And so I know when Vito and I were planning on preparing our bodies to try to conceive, I wanted to make sure that he was really healthy as well. So I had the women from NutriVerb on the podcast last year, and they shared with us their information about their male prenatal vitamin that they created, and they live in Canada. And I reached out to them just to see if I could get you guys a discount code because they're such an amazing product. And women need to take prenatals, so do men. The health of our children is dependent on both of us as a unit. And right now, if you go to NutriVerb, you can get 25% off with the code MM25. It's NutriVerb, NutraVerve. And this next week, so we have Emily Scott on today, and then next week we have Chris Siegfried on, who's going to be talking with us about Desi's birth stories and him becoming a father, the life changes that he's made and the lessons that he's learned, and just given some fatherly wisdom to us. And then after that, we have Doug on. I know he and Jamie just had a baby and are so excited, and he shares their birth stories and the same, just like how fatherhood has affected him. And I just have really awesome open conversations with both of them. So I'm super excited for you guys to hear from them. And I'm super excited for you guys to hear from Emily today. So I'm going to go ahead and get this interview rolling. All right, everyone. I have Emily Scott here. She is really cool. She just told me a little bit about herself. I'll have her tell you about it. But she's a labor and delivery nurse, and she's been just putting out so much information during this COVID pandemic that the country's been through. And I've been following her page, and I know a lot of listeners have as well. And we're going to talk today about just the updates on pregnancy and newborn and policies and things like that. And she's going to fill us in on some things, and she's here to help educate us. So thank you for coming on today, Emily.
Oh, thanks for having me.
Yeah, I would love for you to tell us how you got into all of this.
Yeah, so my normal job is a labor and delivery nurse, but I also do global health work. So I was working in West Africa during the Ebola outbreak. It's 2015, I think now. So that's kind of how I got into all this infectious disease stuff. And then my hospital where I work doing labor and delivery normally, they started up a biocontainment specialty team to kind of deal what was originally for Ebola, but then we never, Ebola was contained and we never got any of those. But they kept the team in case we got any other unusual infectious diseases, and I'm on that team, and we were just to be around and be activated in case something strange showed up. And then we ended up getting the first case of COVID in the States. So I was actually flying back from Cuba, and I turned my phone back on, and I had all these texts this is not a drill. Please respond with your availability to come to the hospital. I was like, wait, what? There's a new disease? Great. So I was working on that team with the very first COVID patient, and that went well and didn't seem to have infected anyone else. And that was back in January. And we were like, great, good job. We did it. And then March hit, and it turned out we, did not have it under control. So I've been working a little bit with the COVID team, and then now mainly I'm back in labor and delivery with COVID and non-COVID patients. So, yeah.
Yeah. Labor delivery, that the majority of a happy place to be.
Yes. And still, I think important to note, like, still the vast majority a happy place. Like, this is a scary time for sure, but still the vast majority of like births are normal and happy and everything. It's just that we're all wearing masks,
Right. Well, and the rules have changed. So I know, I'm a little over 6 months pregnant, and I had an appointment. Yeah, I'm so excited. But I had an appointment every day, and every time I'm asking all of the questions, and then our providers are giving us updated information, but also being like, things are literally changing daily. So I know where I'm delivering, when I go into labor, I'm going to get checked for COVID. Mm-hmm. And I mean, I'm not due till the end of August, so this could be a completely different story then. But as of right now, the hospital policy is, the laboring person gets checked for COVID. And if they test positive, nobody is allowed in with them. And so that kind of freaked me out too, because it's like, okay, but what if I'm positive and my husband's negative and you're not going to let him in? Like, right. I can't do this without him. Like, what am I supposed to do?
Yeah, that's a really, really difficult situation. And the unfortunate thing is that every hospital's got their own rules right now. And so, like, definitely, like, awesome that you are staying informed about what they are, although at my hospital, they change all the time. So we are still allowing partners to be there for COVID positive. They just have to like stay in the room. They can't go wandering around. They're there to stay. They can't go in and out, wear a mask, all that stuff. I certainly hope that as this goes on, that more hospitals will move in that direction. It's really difficult. I want everyone to be safe, obviously. And as a labor and delivery nurse right now, it's definitely scary because I have a family too, and I want to keep myself and my family safe. But we need to find a middle ground between, taking all the rights away from pregnant and laboring people just to protect ourselves. There's got to be some middle ground there. So to me, it seems very reasonable to have your partner there with you, even if you are positive, if that partner stays in the room and stays masked and stays away from staff. The staff's all going to be wearing full PPE anyway, so I'm not sure, just thinking this out, like what extra risk the partner. But as far as I don't think as far as your partner, I don't think legally there's a whole lot you can do if the hospital policy says they have to leave. They have to leave.
Right. Yeah. I guess so when all of this started, we saw in New York that they were making people labor alone, whether they were positive or not. And then the governor or mayor or somebody was like, they need to have somebody with them. And even the World Health Organization says women in labor should be able to have a support person. So it's like, okay, with these different recommendations and where I'm delivering, they've had 0 COVID pregnant patients.
Interesting.
Right. So that's the other thing where I'm like, this doesn't even, if you guys were like having COVID people and you're like, okay, we just need to, I know that there's COVID patients in the hospital and there has been, but the labor and delivery, not one pregnant person coming in getting tested has been positive. So which is awesome. So, but it's like, and for me, so I work as a birth doula. I know how emotional labor and delivery can be. And I love being that for other people. And I can't imagine, I feel like it'd be very traumatic doing it on my own.
Oh, absolutely. Oh, I totally agree. When this all first started, I remember our hospital was trying to figure out what they were going to do. And are we not going to allow partners? And I remember thinking I wouldn't recommend this, but I remember thinking, oh my God, if I was pregnant and I showed up in labor and they told me my husband couldn't come in, I think I'd give birth in the parking lot. It's a really crazy time, crazy situation. And that's why I guess I shouldn't say I'm surprised to hear that some hospitals are still enforcing this rule. I'm disappointed to hear that. I think some restrictions are absolutely necessary. Like, we can't be having the parties in the delivery room like we normally. I mean, I've had like a dozen people in a room before. I'm like, oh, there's a lot of people in here. You know, we can't be doing that. But to me, it seems unreasonable to not have one person there as your support. And I think it is a danger that we want to be aware of during this sort of unprecedented time, that the hospitals, healthcare providers aren't using this opportunity, whether like purposefully or not, but like they're not using it to kind of take control over birth in ways that they have done in the past that are not supportive of birthing, pregnant, laboring people.
Yeah.
So we need to be aware of that for sure. You know, it's a cost benefit, you know, risk analysis, like how much is it really worth to remove someone's partner, you know?
Yeah. Well, that's exactly what I told my midwife, though. I was like, listen, if I get there and they're not letting Vito in, I'm going to go back to my car and deliver my baby, because I'm like,
I know. And that's the thing. That's the thing about it, is in the end, are you putting pregnant people at more risk? Because people are going to, if that's how it goes, people are going to go, okay, well, I'm delivering at home, you know, or I'm delivering in my car, or I'm delivering, you know, and that's probably totally fine for some people, but you're going to get high risk people who really should be in a hospital, who are going to, you know, it just, and I do think the longer this goes on, the more hospitals get comfortable and providers get comfortable, because this isn't going away anytime soon. They're going to have to, you know, figure out how to make this work. And I really do hope that some of those restrictions will loosen.
Yeah. Yeah. Well, she was like, by the time you give birth, she's like, I don't see that being the case at all.
Yeah.
But I mean, really, it is, I mean,
not.
Right. Well, I mean, I know here home births have skyrocketed. So a lot of people are doing home births, which I love. I think that if you find the right provider who has, you know, really good educations, and if you are basically perfect on paper with everything. But I've also heard of a lot of people doing unassisted births, which I had someone ask me if I would be a doula for an unassisted birth. And I was like, I can't, like, I'm just not comfortable. Like, I have no medical training. Like, I don't want you to look to me if anything's happening. Like, I highly recommend hiring a midwife. And I know in Illinois, you have to be a certified nurse practitioner midwife. So you have to, you can't just do the midwife training and practice here. So there's a lot of great ones here, and I've worked with some of them, but I love where we're delivering now, and that's like why we've chosen to stay there, because I actually work with that midwife practice. So
yeah, that's awesome.
Yeah, I know the midwives there really well, and there's an OB, and they deliver out of a hospital, but they're awesome, and it's just crazy because people are trying to make the best decisions for their family. So like another scare is like, okay, so what if I am positive and then I have the baby and they're going to take the baby away?
Yeah. So the baby thing, to my knowledge, it is not legal for a hospital to separate you from your healthy baby just because you have COVID-19. It's even if you go to the CDC website, and I put it in my pregnancy COVID highlight, it's like a screenshot of it. It says this is shared decision making between the patient and the provider. They should be sitting down with you and having a conversation. Like, for various reasons, the CDC is still saying, maybe we should separate babies from COVID positive moms in case they, to lessen the risk of infecting the baby. The WHO is saying keep the baby with the mom. It's much better for the baby to be with mom. So there's various reasons for all of that. But the point being, even the CDC says it's a shared decision-making situation. The provider, the patient sit down, talk, decide together what makes the most sense. Which isn't to say like that in reality, I know in reality it doesn't go that way all the time. Even where I work, I know the midwives in general will sit down and have a conversation and kind of be more granola and it even encourage keep your baby, no big deal. Whereas one or two more conservative OBs would be sit down and be like, we're taking your baby, and if you didn't know that you could say, actually, no, you're not taking my baby. Then, of course you'd be like, okay, I guess you have to take my baby, because it's all about how the provider presents it. So I definitely want pregnant people to know going in that this is a discussion you have with your provider. In the case that you test positive, you guys sit down and say, these are the risks, these are the benefits. Do I want to keep the baby with me and take some extra precautions, or do I want to send the baby to the NICU? But they can't come in and say, we're taking the baby, period. You have no right to keep it. They can't do that. Right. And evidence-based birth has a form you can fill out and bring to the hospital if you're concerned that one of your providers is the one that's going to try and force you, which I hope is not the case very often, but I know different places are different. There is like a form that's like informed consent for refusal of separation. You can fill it out and bring it to the hospital, and you're like, I've read the data, I've signed this form, you were not taking my baby. That's that.
Right. Yeah. Mm-hmm. Well, and I think that's why these conversations are really important, because a lot of times things are brought up as you have to do this instead of you knowing your options. Like, I'm such a huge fan of being empowered and educated and knowing your options and being able to make a good informed decision for yourself. And there's a lot of times, you might not agree with what the provider says, but you have to know too, like, they have your best interest at heart as well. Like, your doctor's not just trying to be an a-hole. Like, your doctor's trying to take care of you as a patient, your baby as a patient, and do what they think's best.
And that's, I know, one of the things, like, right now, I just want to encourage people, like, not to come in spoiling for a fight, because we're still the same people we were before. Like, I got into this because I love women and women's health, and I just want to, like, be there at that moment that women realize what, like, badass warriors they have. Like, I just love that moment, and that's why I'm still doing this. I'm not doing it because I want to make you do something you don't want to do, and also, like, we have families too. We want to keep ourselves safe, and so many people are turning up positive with COVID, showing no symptoms. So we really do need to test you. So I'm trying to do a lot of education and remove all the barriers that people are using to, like, refuse testing. So, like, we're not going to take your baby. We're not going to ruin your life. We just want to keep ourselves safe,
Mm-hmm.
And other people, I mean, like, you don't want the pregnant person next door to you to have refused testing and turn out to be positive, and I'm going back and forth between those two rooms and touching her and touching you, and like, it's for everyone's safety.
Yeah, for sure. So with the tests, can you, like, let's say I'm at your hospital, I go into labor, I come in and I test positive. Could I ask for a retest?
Oh, I don't see why not. Yeah. I mean, I haven't had anyone do that, but I don't know. I'm trying to think. I don't know that I haven't had that situation, but I don't know that it would change we would probably still be like, well, we got a positive test, so we're going to be in full protective gear just to protect ourselves. But usually if we get a positive, we're pretty sure it's positive.
Mm-hmm. Yeah.
I think you're probably at a higher risk of getting a false negative than a false positive.
Mm-hmm.
I don't have the data on that, but that would be, I guess.
Mm-hmm. Just back to the baby thing really quick too, because I was reading that on the World Health Organization as well, just that, like, and there's so many benefits to keeping mom with baby, not only like mentally and emotionally, but just even the bond. And if you plan on breastfeeding, that they've said that's actually, there's been, like, if you were positive, breast milk has tested positive for antibodies to COVID.
Yeah. I saw a study, that they had found some antibodies in breast milk, which, like, all of this is so new. Everything is basically like, well, we saw some studies that said this, but we need more research. So they've found antibodies, COVID antibodies in milk, which is awesome. And then from the studies I've seen, let me look at my data here, so I'm telling you the right stuff. But I think there's only been one case of breast milk testing positive for, like, actual COVID. They've done a bunch of studies in breast milk, and have not seen COVID in breast milk. So I think the risk of transmitting it to your baby through breastfeeding is quite low. The WHO and CDC both are recommending, if you're COVID positive and you're going to breastfeed, to like wear a mask when you're breastfeeding and to wash your hands before you touch your baby. I know that's an easy thing to say when in reality, like as a new mom, you're just like constantly touching your baby. So like do the best that you can, you know? But it seems like as far as breast milk, yeah, it's very low risk. And the benefits, I mean, we all know the benefits of breast milk are basically endless. So yeah. I think some of the discrepancy in what the CDC recommends and what the WHO recommends is, you know, WHO is making guidelines for the entire world. So they have to take like limited resource settings into account. So if you tell a woman in some parts of developing countries that, you know, not to breastfeed her baby, like where are they going to get formula? Where are they going to get clean water to prepare the formula? Like it's just not possible in a lot of cases. So that's a hands down, like easy for WHO to say it's better for a baby to stay with mom and breastfeed and whatever. Whereas I think the CDC is like, well, in most places in the United States, there's clean water and there's availability of formula. But that also is erasing huge areas of the United States where like that's not true.
Right. Yeah.
So, yeah.
Mm-hmm. Yeah. I mean, it's crazy because I mean, this has affected everyone and people can't, I know like when the whole thing came out and people were stocking up on like toilet paper and all this crazy stuff, people were stocking up on formula. Then there was parents who legitimately needed formula for their babies and were going to the store and there was nothing. Yeah. And it's like, whoa, like that's crazy.
Yeah. I mean, that's this whole thing too. Like people have just become, I mean, and it's fear-based, but people have become so individualistic and like we've got to start thinking about we're only all going to get through this if we pull together, you know, like if you are the only person in the world that has hand sanitizer and toilet paper, like everybody else needs hand sanitizer to keep you safe too, you know?
Yeah.
So yeah, I mean, hopefully too, I mean, unfortunately, like I said, this isn't going anywhere. So this is going to be our life for a little while. So we're all going to have to figure out, you know, the hoarding is not necessary, figure out how to do this in the long term rather than short-term panic.
Yeah. Yeah. I know for me, so one of the hard things has been wearing a mask because pregnancy makes you so congested. So I already can't breathe.
Yeah.
And then I'm like wearing them. I've had a couple of panic attacks. One was like in Costco and I like started like, I had like, it was when it was still cold out. I'm like taking off my jacket. I'm like sweating profusely. I'm like pregnant with a cart full. I can't breathe. I'm like, I'm going to pass out on this Costco floor.
Yeah, no, it's no joke for sure. For sure. And like all the more reason for people who can wear masks to wear them, you know, like if you have someone who for whatever reason, like legitimately cannot wear a mask, like better, so much more important for everyone else who can to be wearing them for sure. You know, especially if you're just out on a short outing and if you can handle it for that long. Great.
Yeah. I mean, I do it whenever, I mean, the only place I ever go is the grocery store and I'll put like my mask on. But I mean, my mother-in-law made me one that's like a little, I feel like I can breathe a little better in it, but I'm also just like working through my fears of claustrophobia and, you know, things like that while I'm doing it. I'm like, okay, Liz, you're not going to die. You can breathe. It's okay.
Well, it's new most people in the United States have not been walking around wearing a mask. Like for us healthcare workers, I'm like, this is a Tuesday, you know, even though I'm wearing a lot longer and more of the day than I normally would, but yeah, it's definitely new. It's a huge change for most of America.
Yeah. So what advice, I guess, would you give to people who are delivering soon, who maybe just have some fears around the situation or just if there's anything extra to prepare for?
Yeah. I mean, I would say the data we have right now, even though it's new and we are still learning because this is a brand new virus, you know, the data is reassuring. It doesn't we don't really have any evidence that pregnant people with COVID-19 are like getting any more severe illness or like dying at higher rates than the general population. So that is good. We're not seeing a lot of transmission to newborns either, which is great. So I would say definitely err on the side, if you're going to be delivering soon, err on the side of caution. Keep social distancing, wearing a mask. I mean, that your mask really protects other people, but making sure other people around you are wearing masks if you have to be within 6 feet of people, hand washing, all the stuff you've been doing. I think it's important to note that different places are all different, like opening up at different speeds, and some are paying more attention to data and facts and reality with the virus. Some are paying more attention to that than others. So just because your state is like, cool, we're open, doesn't necessarily, that may fly completely in the face of public health knowledge and facts. So I would say keep erring on the side of caution as much as you can. And then try not to go down the rabbit hole of reading news and reading random people's opinions on Facebook and YouTube, because I don't think it's going to help really. Really try and narrow down where you're getting your information from a few like reliable sources like TTC, and like I watch the ACOG, American College of Obstetrics and Gynecology. Evidence-based birth is great. They have like a COVID page, and every 2 weeks now they send out an email with like in plain English, like breaking down the latest studies about COVID. And I find them to be a really nice middle ground between like super granola and like super medicalized birth. They're just like, it's just the facts. This is the studies. This is how we break it down in plain English. So they're great. Yeah, I mean, just try not to go down the rabbit hole too hard of, reading all the news, because it's not going to help,
Mm-hmm. Yeah. Yeah, for sure. I don't think living in fear is the answer either.
For sure.
I
like
think
knowledge, yes. Awareness of what is going on. Don't stick your head in the sand and pretend that we're all living normal life and everything's fine. But yeah, living just like sucking in everything you can get of every person talking about COVID from any source is like not healthy. It's not going to make you feel good.
Mm-hmm. Yeah, for sure. I'm somebody who like never goes to the doctor. But since I've been pregnant, I've been like paranoid, just because everything's new. And I'm like, wow, like I studied so much as a doula, but like being pregnant now, I'm just discovering different things. Like even just a few weeks ago, I had like a weird random pain in the middle of my back. And I'm like, I think it might be my kidneys. Oh my gosh, what if I have a kidney infection? And I like freaked out, made my midwife test me, and I was fine. I was like, who is this person? I don't know who this person is, because I literally I would go get like my annual exams and my teeth cleaned, and like never went to the doctor for like 10 years. And all of a sudden I'm pregnant and I'm like, wait, what's this? Is this normal? The baby just kicked. Is that supposed to happen? Like,
no, for sure. I mean, that makes total sense. I mean, like, yeah, pregnancy, especially your first baby, is like, so everything is new. And then in addition, this like whole crazy situation is just nuts. But I think the important thing, and I can only speak for my own hospital, but I think this is true in most places, is that, we're getting a handle on this, in that we have systems set up. We are, settling in to be managing this for the long haul. So there's certainly no reason you shouldn't be like going in for your prenatal appointments. There's no reason you shouldn't, if something's weird, call your midwife, go to triage, get it checked out. Like, I certainly don't want to see people sitting at home worried about stuff and not going in because they're too scared they're going to like catch COVID. Or I know there was a lot of talk out at the very beginning, like, don't go to the doctor unless you're dying because the healthcare system is overwhelmed. There will certainly be pockets of that in different places as this continues to play out throughout the country. But overall, like, go to your doctor's appointments, get your vaccines, get your tests, like do as you would normally do, for your pregnancy.
Yeah, for sure. Well, thank you so much for coming on. I would love for you to come on some other time and talk about fun things that aren't, pandemic related and
Sure.
other labor and delivery things. I'm actually starting a short segment series on the podcast doing, as I'm preparing for my birth plan, bringing on different people talking about just like little 10-minute segments, like why this thing might be good or why that thing might be good, or what do you see in labor and delivery that, is weird or good. So I know I was asking my midwife the other day about vaginal seeding, like doing a vaginal swab and rubbing it like on your baby's skin. I'm like, well, if I do a water birth, should we do that? And she's like, no, she's like, usually like with the water birth, the baby's still in the birth canal. It still has the vernix. Like it's really not whatever. That's more of like with a C-section. But even with a C-section, it depends on what's going on. Like, in the operating room, if she said it makes it hard because if you are bleeding vaginally, then it's hard to like get a good swab and rub it on the skin. And I'm like, this is so much information I didn't think of. So
much. Yes, for sure.
I'm like, that's so much fun though.
Yeah. And everything, like I said, the vast majority of everything is still going normally. Everyone's still having happy, healthy babies, and I would also just caution people to be aware that this is all new and things are going to change, and to not get too wigged out as if recommendations change doesn't necessarily mean like anyone lied or messed up, or it just means so many studies are going on right now. So much data is still coming, which is fantastic. But things may change, and just kind of try and roll with it.
Yeah, for sure. Absolutely. I feel like that's the hard thing, because as things change, I feel like people are kind of wanting to play the blame game a little bit. And it's like, everything's so new, and like, you can't, like, people are saying what might be true in the moment, but it's literally changing constantly. So it's like, you lied to me. It's like, no.
Legitimately, at the end of February, I was like, guys, we had one case in Washington and nobody else caught it. And it's been a whole month, like 2 times the incubation period. Like, we're good. We did it. Everybody calm down. And then like a week later, we had this explosion of cases. And I was like, whoops. This is just so new, and there's so little that we know. So, things are changing quickly. But I mean, the only good thing about having so many cases is that it's easy to do research because there's lots of people to study. So we're going to start learning more and more about this, every day. So
yeah, absolutely. Well, thank you so much for taking the time to come on and share with us.
Yeah, of course.
And
I'm at 2 Dusty Travelers on Instagram, and I did a whole thing of highlight of pregnancy and COVID stats and data if you want to dig into all that, and like links to all the studies if you want to read all the actual studies. So it's all there.
Yes, that's what I was just going to ask. Where can people find you? So check out the 2 Dusty Travelers on Instagram.
Yeah, normally we post about travel, but that kind of is over for now.
I know your whole page is like fun travels.
Not so much right now. I'm like pivoting completely to posting about COVID.
Oh man, I know. We were supposed to go on a baby moon to Italy this next week. And I'm like, the other day I text my husband, I'm like, we were supposed to be leaving in a week to be in paradise. I'm so sad.
Wild.
I'm like, maybe we can drive like to the woods and have a picnic.
Yeah, right? I know. It's crazy for sure.
Yeah. All right. Well, thank you so much, Emily, for taking the time to come on and share with us.
Yeah, you're so welcome.
Again, I'm just so grateful for her coming on. Since all of this has happened, she's been so busy, and she puts out so much information on her Instagram page. So definitely go to 2 Dusty Travelers, check out her pregnancy and COVID highlight. And there's tons of information in there. Also, stay up to date at acog.org and ebbirth. That stands for evidence-based-birth.com. They both put out tons of really great information regarding COVID and pregnancy, labor, delivery, all of that. And they're great resources to have with you. Thank you guys so much for tuning in on this bonus episode. If you're not following us on Instagram, make sure you go to the Miraculous Mamas Instagram and Twitter and join us in the Miraculous Mamas Facebook group to be a part of our amazing community. I love you guys, and I'll talk to you later.